Good afternoon, everyone. The first comment I'm going to make is it'd be great if folks could move up, because all I see is a sea of faces off in the distance and lots of empty tables up close. So I just wanted to welcome everyone to the session on the TANF SSI Disability Project. It's very exciting for us up on the podium. We've been working on this for a long time. Before we actually start with the presentation, I wanted to just welcome everyone here. I also wanted to welcome those that are viewing this via the live stream. And I just wanted to say thanks to a few folks. I wanted to say thanks to our federal partners. There have been a lot of folks that have been involved on the federal side, both at HHS and the Social Security Administration, that have been real partners in helping this project evolve and get to the point where it is now. But I wanted to especially call out our 4 project officers that we've worked most closely with. And at HHS, that's Matt Boris and Gurley Wright. And at Social Security, Scott Leverty and Joyce Nicholas. And they've been terrific partners along with the other federal team folks. I also wanted to recognize the team at MDRC and MEF that aren't here. Certainly the work that we're presenting here represents a lot of their hard work. So I wanted to acknowledge them. And I also wanted to recognize the sites that participated in this. We have 3 representatives from 3 sites that moved on to the pilot phase, and you're going to hear from them in a little bit. But in addition to those folks from Los Angeles and Michigan and Ramsey County, Minnesota, there were folks that participated in phase 1 of this project that included New York, Ocala, Florida, Riverside, California, Hennepin, Minnesota. And we actually had a couple of sites that really helped contribute to our thinking and ended up not moving on in the project, but were really important at critical phases early on. And that includes Fulton County, Georgia, and Essex County, New Jersey. So what we're going to do here is Mary Farrell from our team is going to provide an overview of the project, summarize some of the early lessons from the project, and then provide results from our assessment of the 3 pilots. And again, they're represented by these folks here, and I'll introduce them in a couple of minutes when we get to the discussant phase. And then rather than having the discussants present more PowerPoints and things like that, we're actually going to do it more as almost like a roundtable discussion. We have a series of questions we're going to ask them to reflect on, and they'll provide some of their thoughts. And I think that'll still leave us about 20 minutes to entertain questions from folks here and from folks that are watching via the live stream. So we'll try and moderate that to make sure that we have plenty of time left. So with that, I'm going to let Mary introduce herself and get rolling on the presentation.
All right. So the TANF Disability Transition Project, it is examining how TANF agencies and SSA can better serve TANF recipients with disabilities. I'm going to summarize from start to finish. I have a lot of information to provide in maybe 20, 25 minutes, but I think the panelists will be able to expound on anything that I've left off. It is a unique collaboration between SSA, HHS, and TANF agencies of the participating states and counties with the involvement of SSA field offices and the state DDSs. And I'm going to use the acronym DDS throughout the presentation, and for those of you who are less knowledgeable of the SSA side, this is the state unit that determines the medical disability, makes the medical disability determination for SSA. So there are 2 phases to this project. We used phase 1, which we refer to as a knowledge development phase, to get the lay of the land, to really understand how TANF recipients with disabilities are currently being served and the extent to which TANF recipients are moving on to SSI. We conducted field assessments in 7 sites, Riverside and LA counties, in California, Hennepin and Ramsey, which includes St. Paul and Minneapolis, the Ocala region in Florida, Genesee and Mason, Oceana counties in Michigan, and conducted data analysis of TANF data that was reported to the Office of Family Assistance. This is the caseload data that you report to ACF, and we limited it to the 26 states that report full TANF caseload data to ACF. This was merged with SSI and administrative data. And then the pilot consists of 3 pilots, and they were designed to really improve the services that are delivered to TANF recipients with disabilities. And they took 3 very different approaches, as we'll describe. So I'm going to touch briefly on phase 1 work and then spend more time describing the pilots. There is a report coming out in the next week or 2, okay, any day now. And that's going to provide a lot more information on phase 1. What am I supposed to be targeting? Here, why don't you do this? There we go. Okay, the next one, thanks. So from prior studies, we find that there are high levels of disability among adult TANF recipients, 10% to 44% depending upon the study and the definition. 10% really is a very narrow definition. It's limited to recipients who need help with self-care, routine activities like bathing and getting meal on the table, while 44% represents the percent of TANF recipients who self-report on the SIP that they have a physical or mental impairment. So from the field assessments in the 7 sites, we learned that most TANF programs have policies to exempt individuals with disabilities from the work requirements, though most states, with the exception of California, do require that they develop a plan that addresses their barriers, so they're usually required to do something and meet with the case manager regularly. And overall, we found that individuals exempted from the requirements because of the disability are largely overlooked. There are very few employment services that target recipients with disabilities. And from our field assessment, we found that there's really little coordination between TANF and SSA. Most of this coordination typically occurs after an award has been made to coordinate the TANF termination date. And staff know little about the SSI application process, but most of them wanted to learn more. They wanted to know who should they be referring to advocates, for example. How should they be helping with the SSI application process? So from the analysis of the merged data, and again, this is limited to the 26 states, we found that the overlap between the 2 programs isn't as large as we might think. In fiscal year 2007, just 10%, less than 10% of the TANF recipients with, who had open, less than 10% of TANF recipients had open SSI applications. And looking at this from the perspective of SSA, less than 6% of SSI applicants were TANF recipients within a year of the application. So it's not really, there isn't a large overlap between the 2 programs. We found that about 1/3 of the TANF recipients who applied for SSI were eventually awarded benefits. This is actually similar to non-TANF recipients, although the reasons for the denials differed. Non-recipients are more likely to be denied for technical reasons. You know, they don't meet the income and resource limits, while TANF recipients are more likely to be denied because they don't meet the disability criteria. But when MDRC controlled for differences in characteristics, such as age and gender, it reduced the differences in the disability determination outcomes between the 2 groups. It takes over a year on average to complete the process for recipients and just under a year for non-recipients. And so if someone's receiving TANF and their clock doesn't stop, that's 1 year against their time limit. So during phase 1, we were also working with the sites that were interested in developing interventions or enhancements to their existing programs. And so questions emerged from phase 1 that helped the sites hone in on what initiatives might be piloted. And these questions include, are there effective ways to serve TANF recipients with disabilities? How can SSA coordinate with TANF to ensure that eligible recipients are assisted with the application process? And for TANF recipients who aren't eligible for SSI or they're not interested in SSI, are there promising strategies to help them become self-sufficient? So 3 very different questions, 3 very different pilots that emerged. So I'm going to just talk a little bit about each of the pilots and the findings. First, Muskegon County is a county in western Michigan, and it wanted to improve and expedite the state's TANF disability determination process and engage those who were determined to be work-ready with limitations in employment services. LA County wanted to improve their SSI advocacy program that helps recipients apply for SSI and helps them navigate the whole process. Ramsey County, which includes the city of St. Paul in Minnesota, they focused on improving the employment services for TANF recipients with disabilities. So first, I'm going to talk a little bit about Muskegon County. And I should give some background. Michigan uses, it's a very unique process. They use a medical review team to determine who's eligible for exemption from TANF requirements based on a disability. So this is very atypical among the states. And the team, the MRT uses the same criteria that DDS uses to make disability determinations. They're actually co-located with DDS. So that's their current process. A key component of the pilot was to use the SOAR model with recipients who are claiming a disability, and this information could be accessed by the MRT. And so for those who are unfamiliar with the SOAR model, it was designed to improve SSI and SSDI access among the homeless and those who are at risk of becoming homeless, and it involves completing materials needed for the SSI application using a step-by-step process. All of the TANF pilot staff were trained in the SOAR process, and they collected the materials from their participants. And the goal was really to increase staff's understanding of the application process, as well as help the MRT make better disability determinations. So the MRT then reviewed the material, and they categorized the cases into 3 categories. Those who were determined to be work-ready with limitations were referred to Goodwill for special employment services. Those who were determined to be eligible, or potentially eligible for SSI, I should say, the information collected for the MRT was forwarded to the DDS, and that could be used to support their SSI application. And those who were determined to have no disabilities were just referred to the regular welfare to work program. So it was a way to kind of triage and make an assessment and then make an appropriate referral. All staff were trained in motivational interviewing, which is a evidence-based approach. It uses kind of empathic, supportive counseling style to increase motivation. So some results. And I should say for Muskegon, the Muskegon pilot, they're still analyzing some of the data. So we have limited findings from this pilot, but half of the 145 participants referred to the pilot made it through to the disability determination step. Others didn't submit the documentation or SOAR packet. Of those who received a determination by the MRT, most had a disability or work limitation. Almost 2/3 were determined to be work ready, so they were referred to Goodwill. 10% were not disabled, and they were just referred to the regular welfare to work program. And 27% were potentially eligible for SSI or DI, so that information got forwarded to the DDS to help support the SSI application. Overall, the SOAR model received mixed reviews from staff. Management actually thought SOAR was a valuable addition to TANF. They felt that staff had a better understanding of what was needed and that the information sent to the MRT helped them make better determinations. But it was a real burden on TANF staff, in part because they had other responsibilities, and so you're asking them to do other things on top of their already burdensome load. So it kind of got mixed reviews from the line staff. So turning to the LA County pilot, and I should give some background on counties, California's program. LA actually operates an advocacy program that helps TANF recipients with the SSI application process, and there are 6 advocates that serve the entire county. TANF staff can refer clients to the program, but most of them actually come from an automatic referral. Everyone who has been exempt for 12 months due to a disability are automatically referred to the program, and that's where they get most of their referrals. So the county wanted to improve the quality of applications. They focused on 1 county office in Glendale. 2 advocates served in that area and participated in the pilot. They developed ways in which the advocates could communicate with SSA and DDS about the applications they were submitting. SSA and DDS provided training to the advocates, and maybe most importantly, they provided feedback on the actual applications. They rated the completeness and the quality of the application, focusing on whether all the forms were complete. And they also reported on the coordination that took place between the advocate and DDS. They also conducted outreach to TANF eligibility and welfare to work staff, conducted presentations, developed flyer, because there was a real concern that they weren't reaching all of the eligible TANF clients who could benefit from the program. So some results. The research team felt that the pilot improved communication and coordination between the county, SSA, and DDS. They could actually they knew which cases were being served by the advocate, and they had lots of conversations, weekly conversations about particular cases. While the county was worried that the advocates weren't reaching clients, they were contacting about 70% of those referred, so that was pretty good. And this was from a small case file review, but it was also verified with administrative data. It's a little difficult to really assess whether the quality of the applications improved over time, but it doesn't appear that that the quality improved. From a review of 40 feedback reports, 10 had inadequate or missing function reports, 12 of the 40 had inadequate or missing work history. So there are still incomplete forms in the applications. Although DDS felt that the application was better than a typical SSI application, and thought that the real reason some of these cases weren't being approved had less to do with the quality of the application and more to do with the disability criteria. They're just not meeting the disability criteria. And the SSI advocates themselves didn't think that the quality of their applications had improved, but they thought they were doing a pretty good job to begin with. But overall, just 14% were awarded benefits at the initial level. So this sounds really low, but it was actually 7% during the pre-pilot period. So it did increase from 7% to 14% with the assist. And in the pre-period, and for both of these statistics, this is with the advocates' assistance in the Glendale area. But the sample size is quite small, 50 during the pre-period and 60 in the post-period. And there might be differences in the characteristics of the caseload, so we can't really say whether the pilot itself increased the quality. So this pie chart, if you can see it, it provides some of the outcomes of the cases referred to the advocates. The blue slices are those that didn't apply for SSI, and the yellow and green slices are those who did apply. And as this shows, about 40% of the cases referred to the advocates applied for SSI, though just half of these with the assistance of the advocates. The other half, they largely had applied for SSI on their own by the time they were referred to the advocates. But information wasn't available in the TANF system. And the remaining 60% just didn't apply because they didn't think they were eligible or they were not interested. And the decision to apply or not is solely the decision that the client makes. Anyone who's interested can apply, and with the assistance of the advocates. So the third pilot is Ramsey County's Families Achieving Success Today. And to give you some background, Minnesota moves all TANF recipients with disabilities to a solely state-funded program called Family Stabilization Services. And these individuals don't count in the federal work participation rate calculation. Now, the recipients still need to complete an employment plan that addresses their barriers, but they're not necessarily required to be in work activities. So the FAST program focused on employment using the IPS-supported employment model, and I have another slide that talks about that. But it really provided it in this very comprehensive, integrated manner. They integrated and co-located staff from 4 organizations in one location, providing employment, mental health, physical health services, and really the focus was on the whole family, not just the adult recipient. Goodwill was involved, hired, which is a welfare to work contractor, provided case managers. Open Cities Health Center provided a part-time nurse practitioner and a part-time community health worker. People Incorporated provided a part-time child and family therapist. So very, very comprehensive. The staff would meet weekly to review cases and conduct joint meetings together with families and make sure that they all understood what issues other family members might be having. You know, the idea is that, you know, it's important to have a child therapist as well because some of their issues might impede on the parent's ability to pursue employment. So similar to the Michigan pilot, all staff were trained in motivational interviewing. This was evaluated using a random assignment design. Cases were randomly assigned from the FSS caseload. It's a small sample, 241 treatment cases, 148 control cases. And the control group was required to participate in activities, but just not necessarily meet the federal work participation requirements. The IPS-supported employment model was developed to help individuals with severe mental illness achieve steady employment in mainstream competitive jobs. And mainstream is italicized because that's a really important component. They don't believe that you should rely on sheltered work activities. It's been found to be effective in numerous random control trials, and now is being tested with other populations, including individuals with physical health conditions, veterans, and in TANF for Ramsey, and also with TANF recipients in Los Angeles. There are 8 core principles of IPS. Focuses on competitive employment. Eligibility is based on client choice. Now this could be challenging in a TANF environment that focuses more on mandatory requirements, but in the Minnesota FSS world, this is possible. They have a lot of flexibility. It involves integration of rehabilitation and mental health services, attention to client preferences, personalized benefits counseling. In the disability world, this is typically focused on counseling how employment affects disability benefits. They changed it so that it focused more on how employment affects TANF benefits and support services. It relies on rapid job search. They don't believe in using lots of assessments and job readiness activities. Systematic job development is a key component. So basically the job developers really try to understand the client's interests and skills and then develop relationships with employers based on what they learn about the client and try to match jobs to their interests. And finally, the 8th principle is time unlimited and individualized support. This is probably the most challenging to implement in a TANF program that's time limited. But basically, the idea is that clients can continue to receive services for as long as they want them. So now, results. I'm going to go to the 3rd bullet because I just discussed the IPS program and the challenges. And in fact, even despite the challenges, the FAST program received a relatively good score from a fidelity review. They had outsiders come in and review the fidelity, and it gave it a score of 98 points, 2 points below good. It scored a little low on collaboration with state voc rehab, which is not part of the FAST model, and again, the time unlimited follow-along supports, which just isn't achievable in TANF. Only 63% of the treatment group enrolled in FAST, and I'm just making that point because all of the impact analysis that we present includes everyone, regardless of whether they received services or not. So having a 63% participation rate, it does dilute the impacts. Part of that is, families, they're losing their eligibility for SSA, they move to other counties, And we were dealing with an early cohort. Over time, they did improve the screening process a little bit. When we look at participation levels, they're high for both groups. 87% participated in activities for both the treatment and the control groups. But the mix of activities differed, where the FAST group was more likely to participate in job search, and the control group was more likely to participate in education and training activities. So, I don't know whether everyone can see that table, but this shows that there are some reductions in TANF receipt in the first 2 quarters. This wasn't anticipated. We didn't expect there to be any impacts on TANF, especially initially. It is at the 10% level. The table also shows that FAST program increased employment in a couple of quarters and earnings in all 4 quarters. And after 1 year of follow-up, the FAST group earned $1,235 more than the control group. And this is a 75% increase relative to the control group. So these are really promising findings, especially given that the control group faced similar mandates and were participating at relatively high levels. So just a few lessons from each of these pilots. From the Muskegon pilot, we found that they had a hard time implementing the model within the pilot time frame. They started a little late, and they only had 6 months. And so the question came whether there are quicker ways to assess disability. There was also some concern that during the 6 months when they're trying to assess their disability, there's a real focus on what the clients couldn't do. They're trying to prove what they couldn't do. And then 2/3 of them do end up being referred to the Goodwill program and are expected to do something. So they're wondering, is there a way to introduced some vocational assessments during that initial period. From the LA pilot, the team just learned that the application is really complex. It's difficult to take care of the application, especially because it was just one face-to-face meeting. And one thing we saw from the knowledge development phase is that advocacy is provided very differently across the sites. And so one question is, are there components that are critical to operating an effective program? Are there ways to engage participants after the initial meeting? And then finally, from the FAST pilot, we learned that the IPS model is very promising. But it's within this very comprehensive model, and you need all of that. Are there things that you can, if cost is an issue, or if you can't recreate that, are there other ways in which you can find similar findings? Another question is whether it can be replicated in other sites with larger samples. And finally, I know the state was really interested in how this impacts other family well-being measures, and we were really just limited to what's available in an administrative data. So there, if this were to be studied further, I think you'd want to include surveys, maybe even a child outcome study. I know that the state would have been interested in that. So here's our contact information, including the contact information of our project officers. And over the next 5-6 months, I think there's going to be a series of reports that come out from this project. So if you are on NDRC or NBRC's or OPRE's listserv, I'm sure you'll get an alert. Thanks.
Thanks, Mary, and thanks for sticking to your time. So it gives us plenty of time to hear from our discussants. And I just wanted to quickly introduce each of them. And as I mentioned before, what we'll do is we have a series of questions. We'll ask each of them to respond, spend about 3 minutes each, and I'll try and do the time check over here. First is Boyd Brown. He's the Area Director of Employment and Training at Goodwill Easter Seals, Minnesota, and he's representing the Ramsey County pilot. Tasha Drain is a departmental analyst in the Division of Family Program Policy of Michigan Department of Human Services in Lansing, Michigan. And last but not least is Sherry Cheatham. She's the CalWorks Program Director in the County of Los Angeles Department of Public Social Services. So the first thing I was wondering each of you could do is if you had any just kind of broad comments on the findings that were presented for each of your pilots. All of you kind of lived and breathed the experience of the pilot, and we'll dig in a little bit deeper in a minute into some of your experiences. But I was just wondering if you had any high-level reactions around the findings, and Boyd, we can start with you.
Hello. I think some broad reactions that I had is, to be honest, I want to put this a little bit in context. We were actually surprised that we had as good of results as we did, especially around the increased earnings. And the reason for that is it was the first year of implementation, and Mary did talk about that a little bit. First year of anything, especially with a comprehensive model like this, we definitely had growing pains. We definitely learned along the way as we were going through that first year. And so some of the challenges that we were facing, first of all, is that just recruiting and getting people into the project was initially difficult. And one of the things that Mary mentioned is that 63% of the folks received FAST services, and that was because we received the case and then later learned that they were not eligible for the service. They didn't have a disability or things like that, and it was basically a documentation issue with those that we were receiving. So that was one issue. Secondly, as Mary mentioned, that individual placement and support, which is evidence-based practice in the disability arena, we were using that model, and we basically got technical assistance probably about halfway through, and we got some really good training from Dartmouth College, where a lot of the research around IPS comes out of. And I think our services improved dramatically after that, just on a multitude of things that we were working on, especially around job development and systematic job development, as well as vocational profiles that you do with each person. And then thirdly, the fidelity review, we got that after the first year of services. And as Mary mentioned, we received a fair rating, and obviously that means there's things we could work on to do better. So I do believe that now, because we are still continuing our services for FAST currently, and we plan to continue at least for another year through 2014, that the impacts now would be much greater from our perspective. And just anecdotally, seeing the number of folks that are getting employed, that are going off of TANF, and the folks that we're working with are much better now than we were during this pilot phase.
Perfect, thank you.
Okay, for Michigan, the fact that they even have any data to look at was a miracle in itself. There was a lot of staff changes that went on, and when I was the final person to take over the pilot, I had pretty much 2 months to put it together before the start date of June. So to go from June to December and have something to actually look at and focus on was a miracle. Mary mentioned that the staff thought that the SOAR process was a lot more time-consuming, which I'm not very surprised by that, because the normal process that we use is giving a 1 or 2 page form to the client and saying, go to your providers and provide it back to me by this due date. But by using the SOAR model, we put the ownership on the worker to actually work with the client to find out what providers they're seeing, and then actually reaching out to the providers to get the documentation to create a better medical packet. So although I'm not surprised that it's more work for the local office worker, I do believe that it does make a better documentation for MRT to look at it and make a decision.
Hello. Well, going into our pilot, we had 2 major questions, and the questions were our outreach efforts reaching our target population, and were the high denial rates that we were seeing at initial determination, was it due to the lack of quality applications prepared and submitted by our staff, or was it due to the disability level of the applicant? And the results of the pilot showed that, well, we were doing a pretty good job, that the feedback that we got from DDS was that the application submitted was good, and it was really more the disability level of our applicant. So to have a better quality application, it seems, would not have resulted in a different outcome. Our outreach efforts were good, and that although we received excellent training by the SSA staff, our staff felt it was more of a refresher training because it didn't result in new knowledge. So it seems that our staff were doing a good job with the things that they had control over.
Great, thank you. So next, I was wondering if each of you could reflect a little bit on some of the successes and challenges you encountered when implementing the pilots. You know, and anytime you're trying to implement something new or tweak something you're already doing, you know, some things are going to work, some things aren't, and I think it might be helpful for folks to hear some of the experiences around those successes and challenges, and just a little bit about, you know, what you learned and what you would change about, you know, each of your respective pilots.
I guess what I would say about FAST is that one of the big successes was I thought the vision, the service model vision, was well developed prior to even beginning services. And I'd like to give a little shout out to Joan Truler, who's with the state of Minnesota now, but at the time she was with Ramsey County, and really the vision for this project was hers. And really what we were trying to do is really, as Mary was talking about, is really a co-located, integrated partnership with 4 organizations. You know, yesterday I was in the 2 generations services presentations, and one of the things they were talking about was partnership. in that arena, talking about early childhood and employment and bringing those together and talking about what makes a good partnership. And I think in this project, our partnership went even a step beyond what they were talking about yesterday. And some of those things that we talked about around partnership is the 4 agencies that came together to provide services had a common philosophy. Yesterday they called it a common mission. We actually developed a common philosophy as a part of the RFP process. We continued to work on that upon implementation about what is our goal here, what is our vision for services for the folks we're serving, and we need to come together to do that. And then the other piece to it is we truly did integrate services. We called it horizontal and vertically integrated, and what that meant is for the vertical integration, we really had leadership from all of our organizations on an oversight committee so that decisions could be made quickly when implementation challenges came up or things that we wanted to do, we can make those decisions quickly. We had one manager that provides the day-to-day supervision and day-to-day operations that happens to be an employee of Goodwill, but they really were overseeing the overall project, which was extremely helpful. And then on the horizontal integration, Mary mentioned that the multidisciplinary team met weekly. And so weekly we were talking about the participants that we were serving, the families we were serving, and how can we coordinate services better and making sure that they're getting the needed things that they needed. And so from that perspective, I thought we were very well prepared to making this project work well. The other thing I think that was a success is that having a fidelity review of FAIR, I know FAIR doesn't sound so great, it sounds like a C or something, but in the world of IPS fidelity, as a first-time program going through a fidelity review, we probably had one of the highest fidelity reviews of any first-year program. So just to put that into some context too, that we did quite well even at FAIR on that fidelity for the IPS model, so we're very proud of that. And I know, and we're going to have another fidelity review coming up in this fall, and I know we would at least be in the good category at this point, just based on changes we made based on the first fidelity review. So some of the challenges, I need probably a half hour or more to talk about those, but there's many. I have 2 minutes. I think one of the biggest ones, and it's probably the main purpose of this whole thing, was that TANF and disability systems and thinking about those, because IPS, or individual placement support, is born out of the disability community. And to give you a little context, in the disability community, first of all, employment rates are abysmal. 70%, sometimes you hear of unemployment rates of people with disabilities. And also it's a system that really was born out of, we want to protect people with disabilities, protection and risk avoidance. Deinstitutionalization didn't happen that long ago, where people are integrating, and people with disabilities are integrating into their communities. So when you hear IPS talking about competitive employment is the goal, people have choices, they have a voice, they want to be in their communities and be integrated. Perhaps in the TANF world, talking about competitive employment being a goal is not such a big deal, but in the disability community, that's a major shift in what's happened in the last decade or so in that community. So talking about some of the challenges, I think some of the key challenges was in talking about MFIP, that's our name for TANF. But TANF is that the paperwork requirements are just unbelievable. And when you're trying to work with folks to help them improve their chances for employment, to get them employed, and it's also about engaging with people, when you have a lot of paperwork, and I differentiate documentation from verification, and it's really the verification requirements that were really problematic, because it just initially, you have an inherent distrust because you're verifying everything they do, from job logs to are they still disabled. We had medical documentation reviews every 6 months or so. all of those things really puts this kind of barrier to really being able to engage folks well. I think we managed that well. Obviously, we had some good results, but that was definitely a challenge of just getting over that barrier of the documentation and verification of what folks were doing. You know, the other piece related to that is that in the multidisciplinary team meetings, I would say the first 3 to 6 months, unfortunately, a lot of time was talked about documentation. So we'd have the case manager come in, all right, Bobby Sue doesn't have her medical documentation. Do you have it? You know, mental health therapist, do you have it? Where can we get it? And by 3 to 6 months, we decided we can't be talking about those things in these meetings. We need to be talking about these folks, how are we coordinating services, how are we moving them forward, and not talking mostly about documentation. So that was one of the key problems.
And I was going to say, Boyd, I'm going to cut you off there, and we can loop
Okay, sure.
Thanks.
Okay, in Michigan, I was surprised that we weren't really ready to start. As I said, we had a lot of staffing changes internally on the higher level, and so I'm thinking I'm the last person to come in and just let's get ready to go. And when we initially met with the MDRC staff and we met with the pilot county, they said they were ready, and then the start date, it was like, oh, we're not really ready. We thought we were, but we still need more time. So that caused a delay that was unexpected. But some of the successes, motivational interviewing is something that we've never done in the state of Michigan before. And me coming in, you know, I've been a worker, and sometimes the mindset is they're not going to want to go to work, and what do we do? And in Muskegon, the director wanted all of her staff that dealt with the TANF clients to come in and participate in the motivational interviewing training, not just the staff that was assigned to the pilot, which I thought was very good because the feedback was tremendous. I mean, I got feedback that they wish they would have gotten this training when they first started, and some people have been working for the state of Michigan for over 20 years. And just giving them some ideas of not putting it on themselves of what to get the client engaged in, but finding out what it is that they enjoy doing and kind of working from that to get them engaged in something else. So that was a very good success. We also collaborated with the Workforce Development Agency with this pilot, and we did what we called a warm transfer between the client meeting with their TANF worker and them having to go over to the Workforce Development Agency for orientation. We actually had our Goodwill person come over the date that they were meeting with their TANF caseworker to talk to them about the pilot and let them know this is not the same like it used to be if you've been through Work First before. This is really different, and we want to meet you face to face so you'll know who to look for when you go over to orientation, so they wouldn't get lost in the cracks or just get discouraged thinking that it's the same thing that they've been through before. That actually worked out pretty well. We met a lot, like Boyd said. Having the communication with all the partners made a big difference. So if there were issues, we were finding those things out right away instead of 2, 3, 4 weeks or months going by and we not know what's happening with the clients and tracking what's been going on a weekly basis.
Okay, in LA, well, let's talk about the challenges first. One of the clearest challenges are the rules that we have to operate under. Applying for SSI for our age-disabled population isn't mandatory. Our SSI advocacy program is strictly voluntary. Anyone who wants assistance with completing the SSI application, those are the ones that we help. So as it's not mandatory, we're not seeing a great number of people knocking on our door for assistance. Another is the differing definition of disability. Physicians may label someone permanently disabled, but SSA has a different definition, meaning that although you may be disabled, you're not disabled enough to qualify. So although our staff are knowledgeable enough, some of them have been doing this for over 15 years, although they are knowledgeable enough, when someone presents asking for assistance to complete an application, they pretty well know that they probably won't qualify, but they're going to complete and submit the application anyway on their behalf. Another challenge that we faced is that we are unable or were unable to obtain work histories. In LA, we utilize the free service offered by the Work Number to obtain employment records and work histories. And the free service provides, if you know the employer name and code, you're able to access that history. Good news is in late June, early July, the state of California expects to have a contract with Work Number that will allow us to search by Social Security number, so our applications will be enhanced by having work histories. Another is that our staff are not able to complete the functional reports needed to support the application. Those documents are completed by a third party, and as Mary mentioned, we only meet with the applicant once, and that's at our initial interview to get the information to complete the application for an hour, hour and a half. And after that, it's just support. If DDS contacts us asking for additional information, we may contact the client on their behalf. Other than that, we pretty much have no further contact with the client. One of the successes is that through this pilot and the flagging of the cases, we had enhanced communication with the DDS staff. They were able to communicate with us what was needed or what was lacking, and we were able to contact them to ask for statuses of the applications. Now, if we were able to keep that going and have our cases funneled directly to a DDS office in California and not routed to offices all over the United States, that would help us. But through this pilot, we were able to get direct contact and communication. And we believe that contact will continue.
Great, thanks. One more question, and this should take us through and still leave 15 minutes for questions from the audience. So if you all could try and limit your comments to 2 or 3 minutes. One of the things with this that I think is really important to keep in mind is these were pilots. So for example, in Minnesota, they used this a version of this IPS model, supported employment, but it was a test of this model in Minnesota. Similar in Michigan, they used SOAR, but it was a test of SOAR in Michigan, given Michigan's context. It wasn't a test of SOAR across all TANF agencies. So these were pilots. But I was really curious to hear from each of your perspectives, if you could reflect on some of the implications from these pilot results, just in terms of the policies and practices in each of your respective agencies. And in thinking about this, you can reflect on either your pilot experience, the results from your particular pilot, from the study overall, but just thinking a little bit about how that might inform policy and practice for you all.
I think the key piece for us and how, and I'm going to make it a little broader than just our agency and how the policies and procedures for us or implications for us, but just in general, one of the things that Mary talked about is that many state agencies take the disabled, TANF families with disabilities and then put them over here, parking lot, and don't provide services thinking they can't work, they're too difficult to serve, or et cetera. And I think that this project, our project, proved that's not necessarily the case, that we serve very challenging families. And in the disability arena, when you work with vocational rehabilitation, et cetera, we believe everyone can work. There's a possibility that everybody can work. It's just providing the right services at the right time to help them make that happen. And I think this project definitely proved that you can, and hopefully there's more studies on that and really looking at TANF families with disabilities and working with them. I think the other thing I would suggest is that there are possibilities to replicate this in a much cheaper way, I'm guessing, because you can leverage lots of different resources. So it's looking at what can vocational rehabilitation bring to the table, what can TANF bring to the table. And the other big piece that we haven't talked about is Medicaid. I mean, a lot of the services that we were providing through this project were Medicaid reimbursed, which is all the mental health treatment, all the children's mental health treatment, a lot of, obviously the physical disability sources. Really, the cost to provide those services, we had a few dollars to help for the coordination efforts, but otherwise, all of that was reimbursed. All of those health services were reimbursed through medical assistance. And actually, we do have another project side by side with this one, where we're serving TANF individuals or TANF individuals who are now on Social Security because of efforts like SSI advocacy, where we are providing IPS for those folks. And we're showing, I mean, it hasn't been rigorously studied, but definitely have very positive outcomes. And it's a traditional IPS model. It doesn't have all of those other pieces to it that our model had. So I think there are opportunities to do this and to replicate this and make it scalable.
For Michigan, for years we've struggled with this group of clients and what to do. And the new administration that's come in, we got a new governor, and everything has changed pretty much with the program. And they finally have taken a better look that the clients that we serve do have barriers, and not everyone can just go right off and look for a job. And with that being said, the orientation process has changed, and we're currently in talks with the Michigan Rehabilitation Services, and they have now come under our umbrella of DHS, and there's talks of getting them to work with this group of participants. We've done this before, but I think that the results that will come from this pilot will actually help us be more focused of what we need to really do to serve this population very well. And that may include us not using MRS. I'm not really sure how that's going to work, but I think that this pilot ending is very timely, and once we get the results, it's really going to help move Michigan in a direction to really serve this population better, and then move from there.
Okay. In LA, we have a very large TANF population. We serve over 175,000 TANF cases, CalWorks as we call it in Los Angeles, in California, and that equals to over 425,000 individuals. And so it's not a wonder that SSI advocacy is not in the forefront of our line staff's mind. We have 6 SSI advocates, as Mary mentioned, that serve that entire population, and 2 were included in this pilot. And we went into the pilot thinking that we want to know how to do a better job for that targeted population. And the pilot showed that our staff were knowledgeable. They were able to do and were doing the best job that they could with things that they had the control over. And that although moving large numbers of CalWorks participants onto SSI isn't our total focus, we've done a good job with those that we have outreach to, and we're successful in submitting applications on behalf of. And I think, as Boyd had mentioned, that with this population that are unable to fully participate in welfare work, we tend to set them aside, label them disabled, exempt, and leave them alone. And it would be, I think, helpful in Los Angeles if we were to be able to find something that would allow them to do something, something like what Michigan and Minnesota have found.
Great. Thank you. And with that, we actually have about 20 minutes for questions, which is terrific. So I don't know if anyone has any questions.
Hi, good afternoon. I have two questions. I was wondering, in your research and your pilot programs, if you all found that, especially through the advocacy, did you find that there was any resistance as far as through cultural implications and through the stigma of mental illness in regards to trying to locate the people that had special needs and they didn't want to be identified that way in regards to getting the SSI checks and so forth, even though they had the TANF? And did they not want to be identified in that way? And in that regards, do you have the issues with having to reapply, or did the advocacies have issues of having to have the people reapply 2 and 3 times? Because we have that issue, and it's a known issue that usually the first time they're not going to get accepted. And the second part of that question is, see if I can read my notes. Oh, do you also have concerns, especially with the advocacy, did they have concerns with the people thinking that their checks, their SSI checks, will be reduced if they start working, because the SSI checks, I know in Maryland, will be reduced with the SSDI checks if you're on SSDI versus TANF, with SSI would be reduced?
Well, in Los Angeles, when you mentioned mental health issues and was there a stigma, we have found over the years, we've been operating this CalWORKS SSI advocacy program since 2003. And over the course of time, we've heard over and over again, individuals with mental health barriers are afraid that if they move on to SSI, or if someone found out that they had mental health issues, that the Department of Children and Family Services would come and take away their children. So we've run into that wall. And although we've tried to, although we haven't had the motivational interview experience or techniques, we've tried to motivate them and try and dispel that myth, but we aren't very successful there. As far as the reapplication, in 2007, we contracted with Health Advocates, LLC, and they take on reconsideration denials. They take that on. And since they've been in place, we've had a 70% award rate of those that they have represented during that time.
I will say for Michigan, for the SSI advocate to get involved, that means that our medical review team has deemed that they are disabled, so they will meet a Social Security listing. So when the SSI advocate get involved, I don't, or I have not heard that any of our clients are resistant to that. The only thing is, if they already have legal representation, then our SSI advocates don't overstep those bounds. So it's mostly for people who haven't gone that extra step to appeal, or maybe they've applied years ago and they've come back and now they're deemed as disabled, and then our SSI advocates get involved to help them through that process. Because if you are dealing with any types of issues and just going through it, it's a lot of documentation, paperwork, and it can be overwhelming for people who don't have any barriers. So that's how we do it in Michigan. I haven't heard of what you mentioned about people feeling, a stigma if they do have issues, but I'm no expert.
Are they concerned about their checks being reduced once they start working?
If they're receiving SSI, in Michigan, it's not going to affect their TANF, but if it is for the SSDI, then it would. Mm-hmm. But I guess just looking from the outside in, you're talking about someone who has no income or very, very limited income from the TANF grant, compared to what they can get from the Social Security grant or amount. It's a lot more income for them.
Okay, thank you.
I have two questions, and they're different, but I'm going to go ahead and ask both of them. One, Mary, you sort of mentioned that motivational interviewing is an evidence-based practice, and then does she? Sorry, I got your name. You talked about how much it impacted your staff. I'm just curious on what kind of evidence there is, and just a little bit more about what it is, and whether it is something that is both affordable and worth doing more of. And then, Boyd, I have a question for you, which is that even though there's significant impacts, which is often what we see, there are a lot of people who are still not employed. And what do you know about those families? Was it that you tried and couldn't get them employed, or what happened?
Do you want to start, Boyd?
I knew Donna would ask that question. But I don't have a very good answer. So what do we know about those families? One of the things I didn't get to when I was presenting the comments was about engagement. Engagement, because some of the folks that we have on this project are folks that work with folks with disabilities or in the traditional disability system of voc rehab. And one of the things we found is engagement is much more difficult, and maybe that's not a surprise to this room, but much more difficult in the TANF population than it is in the disability community. And I think part of that is just the mandatory nature of the program. I think because a lot of folks with disabilities, when they come to voc rehab, they want to work. I mean, it's something that hasn't been part of their life, and they want to work. In TANF, there's a lot of ambivalence about work and what does work mean to them. And so it's a lot of, and this is actually related to motivational interviewing. A segue to motivational interviewing, we have been doing motivational interviewing for the past 3 or 4 years as part of our agency. We've really adopted it as our culture of how we work with participants. The evidence actually, or where the practice started, is in chemical dependency. And it is it's a series. I'm not an expert on motivational interviewing, but what I know about it's a series of techniques, counseling techniques and strategies on helping people really change and helping them find that motivation and really enhancing and accelerating that motivation to get them to change whatever it is. And how we use it in an employment context, it's really becoming from a non-working person or to a working person. And what does that mean for that person? What changes will happen when you do that? And when they talk a lot about ambivalence, and you'll hear ambivalence about work, what does work really mean for me? And it's really helping them explore that. And then once you start hearing what they call change talk, which is, well, maybe I do want to try employment, it's really encouraging that and accelerating that process to get them to change. We have found in our agency that motivational interviewing is extremely helpful. It's very helpful around a special initial engagement. You get a lot more information faster about that person. They trust you more easily and faster. And then as you're moving along your services with them, you'll see far greater results from that. For the evidence, I would go to motivationalinterviewing.org. And I can't think of both names, but one is Art Rolnick, is one of the founders of motivational interviewing. And then there's one other gentleman, but I'm forgetting his name right now. But if you go to that website, it'll have all the information you want about motivational interviewing.
And I did look at one meta-analysis. It looked at 120 different quasi and experimental evaluations. And basically when they compared it to a no treatment control group or comparison group, but there were statistically significant findings. When they compared it to really active treatment groups, like let's say the control group received cognitive behavioral therapy, that's a very long and active treatment, there weren't any differences. But the fact that motivational interviewing is shorter term, it's less costly, it seemed to be very promising.
And I'll say for Michigan, when workers are new, learning how to be an eligibility specialist, it's more on process of how to determine if someone is eligible for benefits, not necessarily talking with the client and engaging them of if they do have issues. So it was just another tool for them to be able to use that had never been explored with the state before. And like I said, the feedback was more positive than I thought it was going to be. And we are looking at implementing it throughout the state. So, and any tool to help engage our clients is going to be a benefit.
We will be looking into motivational technique. I'll be going on the plane ride home. I'll be looking at the website.
Any more questions? I see Matt going up to the microphone.
Yeah, though I'm a project officer, this is actually a question I don't know the answer to. So, and I've been trained in motivational interviewing, and putting an actual what is it is a tricky thing. But my question was primarily for Boyd, maybe some for Tasha as well. You know, knowing the data that we have that Boyd mentioned about the levels of unemployment in the disability community, and and some of the, the flat, sometimes blatant, sometimes averse responses that that one gets from employers, I wanted to ask, for those who did seek employment, I mean, you did have in a couple quarters statistically significant employment gains. I was curious just what the, if you had a sense of who those employers were there particular companies that you worked with, or sectors, or anything like that, or where was that coming from, and why do you think that that got past some of the barriers that are often there for people with disabilities? And I guess, Tasha, that would also go for folks who managed to get through the program in Michigan, if there are many that you can comment on.
Yeah, what I can say about that is no, it's not related to particular employers. Job development in the IPS model is very different than what you might consider in, in traditional job development. And it's really based on that individual's preferences and what they want to do and choices that they want to make. And then we go out and pursue that for them on their behalf and with them, looking for employers that fit those particular individual preferences and wants. But one thing I want to say, because you just brought up a point, when I was talking to the staff, when I was getting ready for this, when I was talking to the staff about what was the difference from their perspective in working with these folks and looking at employment, and one of the counselors said, well, if you go to any of our job logs for any MFIP or TANF person, what you're going to see on that job log is retail and customer service. That's it, very narrow. And one of the key pieces of IPS is that you are opening up their minds to what employment is and what that means for them. And one specific example that came up, just so you can put it in some context, we had a person that really enjoyed they have a dog, and they love dogs, they love animals, they want to work with animals. And so they explored lots of different opportunities, but what came to them that they really wanted to do was be a pet groomer. And so that employment support consultant took them out to learn about what is it to, what's dog grooming about, what does that mean, how do you get into that position, and eventually they did get a job in that. And so that's, I think, one of the key pieces.
And I would just say, I wonder, if that opens the mind not just of the client, but also of the workers who are often used to doing the same thing over and over.
Yeah,
and pigeonhole their clients.
Yep.
So we actually have a question from the live stream.
This is a question from John in DC. Given your experiences over the course of this project, are you now more or less optimistic regarding the feasibility of substantially improving TANF SSI coordination and helping TANF recipients with a disability sustain employment?
I'll say that I'm still very optimistic. It was just nice to have the research MDRC come to us and allow us to be able to focus on this. And like I said, as a state, we had been struggling for a long time of what to do, and like I was mentioning before, the timing couldn't have been better because now this is becoming a focus of, you know, our clients that do have barriers and how to help them overcome some of those to get them engaged. So I'm very optimistic. I will say that this has been, although it was a very challenging experience, I would not have changed it because it's helped open my eyes to other things, and to be able to see the changes be implemented in the state is going to be great.
Well, we're optimistic in that, you know, we've found the pilot's results have shown that we're doing a good job, our staff is doing a good job, and they've always been willing and able to help those that do accept their assistance. And we just hope that we keep doing a good job for them.
And I would just say, from the perspective of having directed this project for the last several years, I think there's a lot of promise here. I'm really excited. You'll see a lot of things coming out, a lot of deliverables coming out of this project over the next few months. But I do think that there's some potential here, and that's why it's exciting to have projects like this, so you can do some early exploration and kind of figure out what direction to head in. I think we have time for one more question.
Yeah, I don't have a question. I have a comment on what this gentleman here has said earlier.
Yeah.
It's so important because it's something that I have been advocating about in Maryland for years on the disability or the special needs side, where young people leave school and try to incorporate in the community for the types of jobs that they are interested in the special needs community, and they're typecast as not being able to incorporate themselves in the community, when that's really not the case. The case is that they are put in cookie-cutter positions, such as janitorial positions and restaurant positions, instead of the positions that they had asked for, such as working with animals or things that really take thinking that they actually could do. And when you mention the type of positions that they have reserved for people in the TANF community, you're so right, and it's so important that we try to open up the minds of the people who are helping our people in the society get back into society, whatever area that they're in and whatever their handicap might be or whatever their situation might be, that they look at a broader aspect and ask them what they want and really take that into account, whatever their situation is.
Great.
Thank you.
Thank you. Thank you. That was a great comment. So we have 2 minutes left. I wanted to give the panelists an opportunity, anyone, to chime in the last 2 minutes if they had anything to say before we closed out.
I really quickly, I don't know if I answered Donna's question. I'm not sure if there is a good answer about, the 50% that are not working. Whatever the study is, even when there's significant impacts, there's always a big, sizable group that's not working. What I want to say about that, I'm worried about messages that we give people. And I know in this bubble of research and context, I just want to caution, we don't want to say to people, we're going to put you over here because you can't work. I mean, I think we can learn from the disability community from that message. I just know if that was said in a disability conference, there'd be protesters outside right now protesting that kind of message. And so I guess the question is, for me, it's turning that question around to, so if we have, if there's 50% or whatever that sizable portion is that's not working, I feel we've done something wrong. What is it that we're not able to engage? What is the messaging? Because if you think about it, this is a huge challenge for us. These folks have gotten messages their whole life that work is not a viable option for them. I hear a lot talk about motivation here, throughout the conference. People have been talking about motivation and people lacking motivation. Everyone is motivated. The question is, what are they motivated to do and what's influencing those motivations? And for us as a system, as people working with them, if we want to change that motivation or change those incentives or whatever it is that's keeping them from becoming more self-sufficient, I mean, that's our job and that's our challenge. So that's what I want to end with.
Well, what I'd like to say is thank you very much. Thank you to MDRC and MEF, Mike Fishman, Mary, Brett, and to ACF for approving this, and to SSA and DDS for partnering with us. It was an experience, and we hope that from here forward we will do more and can do more for our targeted population. And thank you to my inviting me here, and thank you to my fellow panelists. I've enjoyed talking to you over the course of a year and the relationships we've built.
I'd also say thank you to all of the above that were mentioned. One question that I'm hoping to learn from the research that's being done is, at least for Michigan, for the people that were deemed not disabled by our MRT, and yet they were approved by the Social Security side, and to see, what the disconnect was or what the differences were. That's just a question that I had, wondering how that can happen and why that happens. If that could be further looked into, that would be something that I would be very much interested to hear about. But other than that, this was a great experience. We all have learned a lot, and there's more work to do, but we're all here to continue to fight on to help the people who need it the most.
Great, thank you. So I wanted to thank all of you that stuck it out to the bitter end, and hopefully this was interesting and you learned something. Thanks to the folks that participated via the live stream, and thank you to our great panel. We really appreciate it.